Hello, this is Dr. Shiva Reddy, Consultant Pediatrician, Care Hospitals, Banjara Hills. Today I am going to talk about flu, precautions to be taken in flu and vaccines with regard to it in children. As we know, we are done with the summer season and we are entering into rainy season. So this is the correct time to talk about flu. As schools have reopened after 2 years and it has reopened for all age groups, especially in children, so parents will be having a lot of doubts with regard to flu and how to prevent it. So first I'm going to talk about that. Flu is basically an infection which spreads through droplets. So I request all the parents to make sure that their kids carry a mask and they put on the mask every time in the school, and after that they need to carry a sanitizer and also handkerchief. This is because whenever a child sneezes and coughs, make sure that they cover their nose and mouth with handkerchief. If at all they are not covering taking their handkerchief, they can cover their nose and mouth with hand, and after that, in this case, they need to wash their hands with soap and water and they can use a hand sanitizer. This is a basic thing so that they can prevent infecting other children or other persons beside them. So this is how they can, basic precautions so that we can prevent infection from person to person. Basically, flu spreads faster in close contacts or close gatherings like social gatherings, schools, colleges. So people who are in these kind of gatherings, they should take extra precautions and extra care to prevent the spread of infection. This is way we can prevent flu from spreading from one person to other person. And flu season varies in India depending upon the regions. Especially in southern India where we reside, it is from June to October. So regarding the vaccination, it's better to get vaccinated 2 to 4 weeks prior to the start of the season. Having said that, if you didn't take the vaccine just before the start of the season, you can take during any part of the season. So it will give an optimal effect and optimal coverage so that you will be prevented from getting flu infection. Coming to the people residing in northern India, especially in Jammu and Kashmir, places like Jammu and Kashmir, their flu season varies. It starts from January and goes until April. So I request the parents or the people to get vaccinated 2 to 4 weeks prior to the start of the season. So this way we can get prevented from getting infection. And having said that, every time this vaccination we are supposed to take every once a year. This is because the viral strains change from year to year. There is something called WHO, the World Health Organization. It will suggest the guidelines to manufacturing companies so that they will manufacture the strains which are relevant in that season so that it will give an optimal coverage in the coming season. So every year I request kids to get vaccinated, and I request the parents also to get vaccinated so that the whole family will be protected from flu. So this way we can prevent the infection to spread from one person to one person. And also I request the parents to get vaccinated themselves also every year. So every year, sometimes after getting vaccinated, parents, due to some myths, they won't get vaccinated the following year after 2 to 3 years also. So this is wrong practice. I request the parents make sure that they get vaccinated and the kids to get vaccinated in the local pediatrician or local clinic where pediatrician resides or in hospital. And it's not costly also, it depending upon the manufacturer. It's a bit reasonable rate. So please get yourself vaccinated and your kids vaccinated, and this is how you can prevent flu to getting infected from one person to other person. Thank you.